Hello, I'm Esty Garrity, Chief Medical Officer at Esri. Our world is grappling with a challenge that surpasses any we've faced before, and given the recent global pandemic, that's saying a lot. The alarming proclamation that climate change is the 21st century's most significant global health threat isn't mere rhetoric. It's our reality. The consequences of climate change are vast and varied. Some effects are immediate and apparent. We've all experienced them. Think of things like extreme weather events that cause physical injuries, or overwhelmingly hot days that lead to heat exhaustion, heat stroke, or even death. Other consequences are less direct, yet can be just as devastating. Consider droughts, which strain our food systems. Now, in some places, this may simply create the nuisance of decreased choice. But in other places, food insecurity results in malnutrition and mounting mental stresses. Increases in air pollution exacerbate cardiovascular and respiratory conditions, and surges in waterborne and vector-borne diseases are an increasing concern. For example, a warming climate can not only expand the geographic range of disease-carrying vectors like mosquitoes, but it's also increasing the season length for these insects. And in case you weren't aware, mosquitoes are already considered one of the deadliest creatures on Earth, causing hundreds of millions of cases of illness and 500,000 deaths every single year. Addressing these challenges facing our communities isn't just about supporting the environment, but also changing systems. Actually, our healthcare systems contribute significantly to carbon emissions all by themselves. The initiative to decarbonize healthcare, it isn't a future goal, it's a pressing need. It's been said that if the healthcare sector were a country, it would be the 5th largest greenhouse gas emitter globally. In the United States alone, healthcare contributes to nearly 8 to 10% of the nation's total greenhouse gas emissions. From the production of pharmaceuticals and medical devices to the energy-intensive operations of hospitals, this is a substantial problem and certainly an unfortunate irony in climate-induced health impacts. However, many healthcare organizations do recognize the paradox and are actively working to reduce their carbon footprints. Their strategies and adaptations include energy-efficient infrastructure, sustainable procurement practices, waste reduction, and integrating renewable energy sources. Healthcare institutions globally are recalibrating to aim for a net-zero future. All these climate-induced health challenges call for a response that is collaborative, strategic, and rooted in both science and technology. The journey to adaptation and resilience begins with understanding various exposures across the list of threats. And because climate-related hazards differ temporally and geographically, it's critical for solutions to be tailored to the unique circumstances of each community. For example, in the city of Tucson, Arizona, they're using GIS to prioritize locations to plant 1 million trees by the year 2030. And all the way across the U.S. in Miami-Dade County, Florida, GIS is used to track and map requests for funding through their Low-Income Home Energy Assistance Program, which helps qualified households pay for heating and cooling. Now we can focus on investigating options, prioritizing, planning, and ultimately taking decisive action. In this week's lesson, the focus is on creating adaptation plans to address the impacts of climate change, like extreme heat. Did you know that among all weather-related events, extreme heat is the deadliest? In the U.S., heat is responsible for over 700 deaths per year, and most of these are preventable. So, this is a really good place to start. How can GIS help? Well, many communities are using GIS to identify heat pockets that exist as microclimates within cities. Prague and Czechia is a great example of that. Many health departments are evaluating vulnerable populations to highlight areas of risk and disparity. And of course, GIS is being used to design interventions specific to local community needs. Those interventions might be grouped as shorter-term solutions and longer-term solutions. In the short term, a geographic approach is critical to the regular surveillance of weather conditions, which can then support public alerts and then trigger heat response plans that can save lives. Since GIS has the ability to enhance collaboration with tools like ArcGIS Hub, it can be used to organize people, data, tools, and community partners participating in this work. It's also relatively easy in the short term to share key community resources to help people cool off when it gets too hot. Los Angeles, California is doing this by listing nearby pools and splash pads, libraries, recreation centers, and hydration stations in an app. Some interventions and adaptations, of course, take longer to put in place, but are equally important to mitigating the health impacts of extreme heat. This might include building new green and blue infrastructure. Now, when I talk about green infrastructure, I'm talking about planting trees to increase shade, decrease cooling costs, and lessen air pollution. And blue infrastructure is about water and hydration opportunities across a city. We could think about policy approaches, which might include updating building codes for insulation and air conditioning requirements, funding energy assistance programs, and alleviating houselessness. The possibilities are endless, and ArcGIS can support it all, from sharing authoritative data in ArcGIS Hub and modeling and prioritizing the options in ArcGIS Pro, all the way to providing community resources in web apps, telling stories with story maps, and tracing progress with ArcGIS dashboards. You know, I've always believed that our health is our most valuable resource, and we must relentlessly protect it. The call is urgent. The stakes are high, and the challenges are complex. But our determination, backed by robust GIS technology, can help us plan for and build resilient communities as we look to create a healthy and sustainable world for all of us.